Good morning, everyone. I'm Ashish Singh, President AI Platform at Innovaccer. And today I'm joined by Jigar Thakkar, CEO, Longitude RX. Today we're going to talk about the most overlooked but yet most impactful problem statement that we have been seeing with the health system, specialty pharmacy. Specialty pharmacy has a specific impact in terms of how health system kind of operate on day-to-day basis, how their P&L looks overall from an end outcome perspective as well. Now, if we talk about the overall medication spent, specialty medication is about 60% of that. Not only that, 80% of the new medicines coming in is coming under the category of specialty pharmacy. Yet, this sector is highly overlooked overall. The journey from pharmacy order to the patient receiving the care is still fragmented, it's still siloed. It's the overall care management is underestimated all the time, and we are still dealing with like a highly fragmented process overall. Jigar has spent majority of his career in transforming this specialty medication business. He has worked with the large health systems overall. So Jigar, tell us about your journey, how you are seeing this problem, what is keeping the chief pharmacy officer up in the night still, and what are the kind of challenges that you are seeing on the ground as well?
Yeah, thank you for having me. And it sounds like you actually know all the statistics even better than I do. But I think you're right on. So number one point I'll state is, specialty pharmacy, as Ashish was saying, is definitely the largest lever health systems have at their disposal to really transform the care delivery model. I say it's not just a revenue play for health systems, but it's one of the most important clinical care delivery plays that a health system is encountering today. If you look at their patient population, as Ashish was touching on, majority of the patients going through a health system today, whether the health system executives know it or not, are on specialty medications. And what makes this a challenge and an opportunity is that, these specialty medications are extremely complex to manage. You really need an infrastructure at the health system side. You really need the support and the technology to be able to manage what the patients are on these days. Ashish also rightfully said that the FDA pipeline really consists of more than 80% of medications that really are specialty meds, right? So the market is not slowing down, and the complexity of these medications continues to go up, right? So you asked what keeps chief pharmacy officers up at night. I think, they're basically put as the responsible party in health systems for, not only pursuing the revenue opportunity associated with these specialty medications, but ensuring really an end-to-end care delivery mechanism, which is highly complex and highly fragmented. And so I think, coupling that, responsibility that the chief pharmacy officers have with the fact that, they are seeing, just like everyone else, staffing shortages, right? So one of the things that, most people know in the pharmacy world is, having pharmacy technicians, sometimes even having pharmacists is really hard to come by. And so when you're, talking about this extreme responsibility with the fact that you have this, massive, staffing shortage and a lot of complexity in terms of the payers and manufacturers that really get involved in this space, it really, begs for assistance in the space. And so what we're seeing is many different vendors really coming to the market, really trying to address this need and problem. But, what we're going to talk about today is really, relaying to you all, how we're trying to do this as a combined entity between Innovaccer and Longitude RX, and how we think we have the right to win in this marketplace in order to help our health system colleagues to really face this challenge.
What we are also seeing, Jigar, is that there is a record increase in terms of what specialty drug is contributing in terms of the overall operating cost for the pharmacies as well. It's about 60%, which is like extremely, extremely high.
Right.
And the numbers are increasing. What do you think? How is this going to impact the health system financially and from a clinical workflow perspective? Because there are just so many inefficiencies that currently exist. So how you're seeing that?
Yeah, great question. So if I put my CFO hat on of a health system, I really think about, okay, these medications are highly expensive, right? So is that a cost burden or is that a revenue burden, right? And it all depends. If a health system doesn't manage their specialty medications and their specialty population well, it's going to actually become a cost burden and it's going to be extremely inefficient. Believe it or not, some of the leading health systems that we're working with, they actually don't have a separate P&L that really looks at specialty pharmacy individually. Most health system CFOs know how many surgeries they're having on a weekly, daily basis, how many patients are in their beds. But if you ask them how many patients are on specialty medications or what does this really represent as a part of your P&L, I'm not sure the answer is very clear. But if you really start looking at the numbers, Ashish touched on it a little bit, but specialty medications really can actually account for, believe it or not, 20% of your net patient service revenue as a hospital system. So it's definitely something that needs to be looked at and paid attention to. And if not managed correctly, it becomes this cost burden that is not revenue generating, right? So a health system CFO, first and foremost, really needs to look at, is this specialty medication part of the good spend at my hospital system or part of the bad spend? And really be able to differentiate that. And then, we'll touch on the clinical side, but, the financial side is extremely important.
Yeah. 20% is really high.
Yeah.
So now we are living in the world of AI where everyone is like AI kind of thing. How do you see the opportunity for AI in the world of specialty pharmacy? What is the kind of opportunity that you're looking at? How do you think that AI will help in transforming the inefficiency that exists at this point of time?
Yeah, I think this is honestly one of the most exciting times in our history in healthcare. I think that some of the challenges that health systems have faced, including the chief pharmacy officers, is managing the multiple systems that they have to deal with, right? So, if you look at any given health system, they have a 340B TPA, which is, a set of companies are providing that solution today that even if you use an EMR such as Epic, Cerner, or Meditech, you're having to partner with another vendor, another point solution to handle your 340B compliance needs. Now, if you look at prior authorization, we see a lot of vendors, a lot of point solutions out in the market really providing prior auth automation, right? And that space, due to AI, is getting better and better every day. But, if you really look at the bigger picture, that's another point solution that a health system executive has to deal with. And really another system, even if it's integrated, it's really another system that's coming into play. Now, if you look at other aspects of what a specialty medication journey looks like, such as financial assistance, right? Patients who are on specialty medications often need financial assistance programs. Those programs are extremely fragmented, and they're reliant on various different provider networks. And so essentially taking a look at the specialty medication journey, you see that there's a lot of different systems involved, IT systems, technology systems. There's a lot of different kind of workflows involved. And so back to your question on, what do I see as the role of AI? I really think that AI can transform this, specialty pharmacy medication journey from an end-to-end perspective like we haven't seen before, right? So I think many of the leading health systems in the specialty pharmacy space have done a great job, but have really done it, from a very manual basis, right? And really done it through operational rigor, and really having kind of many different, parties involved. But I think with the advent of AI, I think you're going to need less involvement and less kind of process related needs, right? So I think from connecting those end-to-end fragmented pieces to really producing a much cleaner workflow for your health system experts to take on is something that's going to be possible with the use of AI.
No, absolutely. I think there are two chain of thoughts that is going on in like each health system's mind at this point of time. Do I need to act now, or can I delay it by 2-3 years as well? So if we put a perspective of like not modernizing your specialty pharmacy part of the world today versus doing it in like next 2-3 years, what does it mean from a patient journey perspective, from a care management perspective, and the overall flow of the medication perspective as well? Because if you are not moving, your competition is definitely moving in that direction.
Right.
How do you see that, like kind of evolution, that should we act now? What's the level of urgency that you're sensing?
Yeah, I think the level of urgency is really high, right? So, again, going back to the specialty pharmacy market, right? So, if you look at the market, it's a $400 billion market, right? And so, it's not just health systems really recognizing the size of the market. You have payers, you have manufacturers, you have PBMs who are well aware of this market size, right? And so, what's happening today is a lot of other kind of players are really coming into this space, right? So you see a lot of PBM-owned pharmacies, vertically integrated pharmacies, really taking, the patient's prescription away from the health system, and as that prescription is leaking, it's being filled by other outside players, right? And why is that a bad thing? It's a bad thing because if you look at it from the patient's perspective, it's not just about where the revenue is split up. Is it between the provider side? Is it at the payer side or the PBM side? It's really the fact that it's causing clinical fragmentation in the care, right? So if a patient is getting certain care at the health system, they're getting certain meds at their, designated PBM pharmacy, and then they're getting other medications at their local community pharmacy, it tends to fragment their care. And then, again, going back to the complexity and the needs of this the needs of the high touch that is needed with these specialty medications, really, if you're, allowing someone else to intervene in that part of the care journey, then you're really asking the question, well, who's going to help that patient with the financial assistance? Yeah. Who's actually doing the prior authorization? Is it the doctor's office, or is it Optum, or is it, CVS? So you're really kind of starting to fragment the responsibilities that are involved in that specialty pharmacy journey. And so it's really more about not, we're taking revenue away from one side or the other. It's really ensuring that there's like an end-to-end coordinated journey for the patient, right? And thinking about the patient's experience with that specialty medication.
Well said. And I still remember when we were talking about the partnership between the Innovaccer and the Longitude RX. The thought process was that how we can bring in the simplicity in the whole process. How can we break the silos that exist at the different hops of the journey altogether? Let's talk more about that. So this partnership and how you are thinking it's a differentiator or differentiating solution that is going out in the market together. Innovaccer brings in top of the technology, while the Longitude RX brings in the expertise, the understanding of what happens in field.
Right.
And there is a say that what you build in a classroom versus what you have felt and seen in the field and kind of evolved the software over there, that's covers the last mile as well.
Yeah.
So what is the differentiation? What's the offering, the LRx360 solution that brings to the prospect, to the customer altogether?
Yeah. No, we're extremely excited about this partnership and bringing LRx360 to the market. I think, Ashish, you touched on it really is, you see, again, a lot of different solutions in the market where, it's a technology company, providing a solution to the health system space, right? But, if you think about it, at the end of the day, they're a tech company, really not knowing the intimate, workflows of that health system. But then if you look at the health system side, if you have that expertise in the workflows in the, health system kind of clinical expertise, you really don't have the technology expertise that you need. So, why we decided to partner is really exactly what you said, right? Bringing the top of the technology expertise and really combining it with our health system expertise. So as a brief background for everyone on Longitude RX, really it was, Longitude RX was created by 5 leading health systems for the very reason that they felt that, what was available in the marketplace didn't meet their pain points and didn't really meet their needs. And so Longitude RX was very specifically designed as a utility created by these founding members and founding health systems. And then if you look at the makeup of our teams as well, I served as a chief pharmacy officer. I'm a pharmacist by background, and really, worked on those front lines with the health systems to really, manage specialty pharmacy medications. But the reason for this partnership, coming to fruition really is taking the technology component and really co-designing it with the health system workflows in mind so that we can take that to the market where it really meets the needs of our health system partners like nothing else out there.
Makes sense. And I think when we were talking about how we should envision the entire journey, the key point was that how we can bring the care coordination forward at the point of care, then making it like an afterthought. Because whenever you go in afterthought, it's like already by design, it's a fragmented and siloed journey point that we have created. Now with this, can you talk us through like how would the future look like for the practices when they land on a health system, when they land on something like LRx360, which is truly transformational in terms of how you have thought about in terms of stitching not only the eligibility check, getting into the prior auth, getting into the financial aid, and thinking of this entire journey not as in a fragmented pieces of the journey, but one end-to-end journey to drive the outcome for the patients?
Yeah, great question. So, I talk about the design of the solution itself, right? So it's obviously being co-designed by our Innovaccer experts, first and foremost, but we partnered with our clinical pharmacists who have, worked at places like MD Anderson, right? So one of our leaders in the product and innovation side, she worked as a clinical pharmacist for 10 plus years at MD Anderson, really in the front lines, as you stated, servicing those patients, right? So if you look at what's even going into the design of the product, I think you're going to see something that is very different than, how others come to market, right? So, and then we're thinking about that health system kind of frontline employee who's going to utilize this, and thinking about the pharmacy, the pharmacy team that's going to use this software, right? So essentially the way we've designed it is in a way that as soon as we implement the software, you're going to realize benefits right away because it was really designed with that end user in mind from the very beginning. Currently, we are in the phase of alpha testing with some of our customers and really seeing and iterating on it very quickly so that we can actually provide this to a much broader marketplace.
I think and as you always say that it's a customer first approach, right? And you yourself being worked as a chief pharmacy officer in the previous experience, plus the team that you have hired, bring a lot of knowledge in that sense. But your network of the chief pharmacy officers and the people you work with, or the customers that we have happily onboarded onto the platform as well, how are they contributing to make a significant differential product for the market? How are you gathering that intelligence altogether?
Yeah, no, great question. So, first I touched on the makeup of our team, right? Yep. Which is primarily chief pharmacy officers and clinical pharmacists who have worked in health systems, right? So they not only have that intimate knowledge themselves, but our network is strong. So in the pharmacy space, we all know each other, right? So, I can call up 50 different chief pharmacy officers if I needed to today. And so to your point, what we're doing with our Longitude RX team is really bringing those chief pharmacy officers in the design phase, right? So just a couple weeks ago, we had a chief pharmacy officer from one of our academic health systems, Michigan Medicine, in our San Francisco offices, helping design our cell and gene therapy product, essentially. So, we're bringing in these chief pharmacy officers for their expertise and bringing in clinical pharmacists for their expertise to really design that product so that it meets their need from day one.
No, absolutely. We have witnessed it firsthand in terms of those design workshops as well. Talking about the customers and Michigan Medicine and others in that category, what is the kind of journey they have started to see on LRx360? What kind of outcome that they have already seen or they are anticipating to come in like next couple of weeks or months to come?
Yeah, perfect question. So, one of our health systems in Arizona that we partnered with as a customer really is going to be that, alpha testing site. And so what we're seeing early on is as we've, begun implementing our MVP product, we're seeing that, it meets their end-to-end needs. So this is a health system that really doesn't have kind of the resources to manage all of the different workflows that are needed in the specialty pharmacy space. What this tool does immediately for them is be able to really coordinate that patient's care from an end-to-end perspective, so that even if they don't have someone, responsible to manage a certain aspect of that medication, the Longitude RX team can step in. But what the platform is allowing us to do is really track that patient from an end-to-end perspective, right? So the patient is not lost in that care journey. Whereas in the previous state, without using this type of, without using LRx360, that patient's care coordination becomes much more complex. Whereas, today, we don't lose sight of that patient, right? So even if, let's say, the medication can't be filled at that health system for whatever reason, and it has to go to, an outside contract pharmacy, we make sure that, the tool, the LRx360 tool, is allowing us to track that, prescription from an end-to-end basis, so that the patient still gets the full support that is needed, regardless of whether that, medication is filled at the health system space or at that contract pharmacy.
Yeah, no, it makes sense. It's always a mix of like people, process, and technology. And that's how we have been thinking about how we can kind of not think this as in a siloed stuff. How can we package it together? That's where the software and the experts from the Longitude RX team comes together to transform the business. Now, talking about the implementation, what is the kind of implementation cycle that you are seeing for the customer, and what the success will look like or looking like for the customers in like 6 to 12 months?
Yeah, great question. I think, most health systems know this, right? All health systems have different priorities that they're working on, right? So even their IT departments have many different priorities that they're working on. But, the first thing that when we bring LRx360 that we talk about with the leadership is really that this lever really represents financial opportunity like nothing else, right? So, and a clinical opportunity like nothing else, right? So, we tend to, especially in our initial customer base, we tend to kind of jump the line in prioritization in terms of prioritizing the LRx360 implementation. The second thing is that we look at, you mentioned there's a people part involved and there's a technology part involved, right? So we're not just giving a tool and kind of saying, go ahead and use it and see what comes of it, right? We're making sure that we have experts really defined and assigned to the implementation and the execution of this tool, because there's so much complexity, again, in this space, that you want to make sure you're getting the benefits that we're thinking are there. And so you get a team of individuals with the tool to essentially implement and look at the strategies that you should be going after in terms of improving your specialty pharmacy program.
Yeah. And if you look at the specialty pharmacy, part of the world has been like extremely fluid. Talk about 340B, the regulations that came in recently, everyone has to implement, and then there is a pause on that one, and there is like continuously changing requirement altogether. And you rightly described that it's not the tech only, but build the tech in a way that it kind of adapts to those changes like fairly quickly, while we have the expertise coming from the Longitude RX altogether.
Right.
Now, pivoting from there, if you think about, and given you have been in this field for a long time and you have been talking to a lot of chief pharmacy officer, what are the top one or two themes that you are seeing in total from them as a pattern, which if they get a opportunity to solve, they would like to solve that problem like yesterday?
Yeah, I think number one would be kind of the fast changing regulatory environment. So you mentioned 340B, right? So we've actually been very thoughtful in thinking about LRx360. So we didn't just want to address what we think is an opportunity today in terms of capturing specialty medications at your own health system pharmacy, or else being able to look at where the medication can go if not at your internal pharmacy. But we really thought about what else is there in the marketplace that is a challenge, exactly what you asked, right? So the regulatory challenges around 340B are always happening, right? And so, yeah, we heard about the 340B rebate model, which is, currently in a pause. But what LRx360 is able to do is essentially be able to pivot and be able to address these challenges very quickly. Why? Because it's already getting all of the necessary data that it needs, right? So instead of a health system chief pharmacy officer or 340B team coming up with a different process, and that process may look different at different health systems, we really now have a platform that can pivot very quickly and be able to be responsive to those changes. So the second thing on top of mind with chief pharmacy officers is really this question about payer and manufacturer access. So even if you have great operations in place, there are payer restrictions, there are manufacturer restrictions. So what Longitude RX is doing about that is by aggregating the data that we're getting from all of our health system partners, we are able to actually get contracts to limited distribution drugs directly from manufacturers. This is not just a theory, but we're seeing early results from it. As soon as Longitude RX launched this strategy, within a month, we were able to get 3 limited distribution drugs directly from manufacturers. So, if you become a Longitude RX Innovaccer customer, you get access to this limited distribution medication, right? So we're being very thoughtful on, not only helping capture the revenue, through LRx360, but ensure really an end-to-end clinical management of the patient and ensuring access through the pharma manufacturers and payer side as well.
Yeah, so you're not looking at this whole solution in isolation, and specifically not just for the health system.
Right.
You're looking at the ecosystem level.
Yeah.
That how the payer, the pharmacies, and the health system are going to work together in very kind of collaborative manner. That brings to the last question. Given we have worked on this LRx360 solution, we are seeing some impressive kind of results already and strong signals from the customers where we are in the incremental and the implementation journey altogether. What is the long-term success or the strategic vision for LRx360? How you are thinking about it, and how this you think going to redefine the way a health system or a provider working with a payer and working with a pharmacy in that equation?
Yeah. No, I think in healthcare, we know that different parties have different incentives, right? The provider side has its own incentives, the payer side has its own incentives, and pharma and manufacturers have a different set of incentives, right? And so I think that's sometimes the problem in healthcare. But I think, with this type of platform, we're being agnostic to a provider side, a payer side, or manufacturer side. So really the long-term vision of this platform is being able to connect the dots between all the different sides as we're talking about, because we're doing that already, is being able to connect the dots where the patient essentially wins in that end-to-end, prescription journey, right? So you get the data that you need on the payer side, you get the, data that you need from a manufacturer's perspective, but you also get kind of the care journey management from a provider perspective, all in one platform. So we plan on being able to continue to partner with, payers, PBMs, and manufacturers, as well as our health system partners in developing this platform further and further.
No, absolutely. I think that shapes the vision very nicely. And we are already seeing the response and the success stories coming all together. Jigar, thank you very much for sharing all those insights, sharing your vision, your thought as well. It's great to be such a kind of a partner and transforming and disrupting the whole industry in that pharmacy specialty solution as well.
Yeah, thank you.
Great to have you.
Thank you.